Dear friends, as we know that about 85% of breast cancers occur in women who have no family history, knowing the modifiable factors which increase the risk of developing breast cancer becomes very pertinent. Why? Because if we know the first A, that is aware, we can go to the subsequent A's, that is avoid and assess, and be more inclined to activate the Brahms protocol, that is BP. I have already discussed how estrogen and pregnancy are interlinked and how pregnancy affects breast cancer risk. I will now be discussing the other modifiable risk factors, which are they, what are they, and how they increase our risk of developing breast cancer in detail. Still, if there is any aspect in which you need more clarification, please write in the comment box. I will discuss them subsequently. Okay, for today, number one, no breastfeeding after delivery of the child. Now, this definitely increases the risk of developing breast cancer. You probably know that breastfeeding can give your baby a healthy start, but that's not the only health benefit. It also lowers your breast cancer risk. The important point is breastfeeding, particularly for at least 6 months. Please note, for at least 6 months decreases the risk, and longer the duration of breastfeeding, lesser the risk. Breastfeeding protects you is that women who breastfeed experience hormonal changes during lactation that delay their menstrual periods. This reduces a woman's lifetime exposure to hormones like estrogen, which would have promoted breast cancer cell growth. Plus, in addition to this, during pregnancy and breastfeeding, you shed breast tissue. This shedding can help remove cells with potential DNA damage, thus helping to reduce your chances of developing breast cancer. In a study, researchers also found that for every 12 months a woman breastfeeds, her risk of breast cancer decreased by around 4.3%, which is very significant. The study compared mothers who breastfed to those who didn't. It also found the 12-month time period could be with either one child or more than one, for example, twins. And amazingly, another study which examined the breast tissue from women with breast cancer, they found that women who had breastfed had a 30% lower risk of recurrence. 30% lower risk of recurrence of breast cancer and a 28% lower risk from dying of breast cancer, which is obviously very significant. So after breastfeeding, other factor number 2, late age at menopause. Menopause, late age, that is after 55 years. Now this increases the lifetime exposure to estrogen and therefore increases the risk of breast cancer. For your information purpose, menopause is a point in time 12 months after a woman's last period, and the menopausal transition most often begins between ages of 45 and 53 years. Another important factor number 3, that is nulliparity, that is no pregnancy and obviously no children. Those women who do not start a family have increased risk compared to Paris women, and this risk is around 1.4% more, obviously because they continue to have ovulatory cycles and therefore they have an increased lifetime exposure to estrogen. Number 4, another important factor is obesity. How obesity causes an increased risk of breast cancer? It's multifactorial and therefore a bit complicated, premenopausal, postmenopausal. Let me explain to you in a very simple way. Okay, adipose tissue, that is fat, is a major source for storage and metabolism of sex steroids. Metabolism means how it is stored and then neutralized. Okay, so among which estrogen is the main sex steroid in females, and adipose tissue, therefore, because it is a major site for storage, increases the estrogen levels. Now this becomes even more prominent in postmenopausal women, because in postmenopausal women the estrogen is not being produced by the ovaries. Now therefore it becomes the main source of estrogen in postmenopausal women. Premenopausal, the ovaries are also producing estrogen and the fat cells are also storing estrogen. So it has a bigger role to play in postmenopausal, but yes, also to some extent in premenopausal also. Therefore, obesity is associated with both an increased risk of breast cancer development in postmenopausal women and increased breast cancer death. Now, how do we measure and define obesity? It's a very simple concept. We use the concept of body mass index, that is BMI. Body mass index is a person's weight in kilograms divided by a square of height in meters. Slightly complex, but don't worry about the calculation. There are several free online sites on Google who will calculate your BMI. All you need is details of your height in centimeters and weight in kgs. The normal BMI is a range between 18.5 to 24.9. Now what they have found is that women with a body mass index of more than, that is BMI of more than 31.1, have a 0.5-fold greater risk of developing breast cancer than those with a body mass index of less than 22. A bit more in detail, because I know a lot of you would be interested in knowing the mechanism involved. Now, what I repeated, I'm going to explain that now in a bit more of detail. There are different mechanisms of estrogen dependence for hormone-related breast cancer, that is ER/PR positive related breast cancer in pre and postmenopausal women. In premenopausal women, the main site of synthesis of estrogen is the ovary. In postmenopausal women, adipose tissue, that is the fat, is the main source of circulating estrogens. Therefore, adipose tissue produces the enzymes aromatase. Enzyme is a chemical which accelerates the reactions in the body and is responsible for most of the metabolism in the body. Okay, so adipose tissue, it produces an enzyme, produces a chemical known as aromatase. Therefore, in obese women, there is an increased conversion of androgen hormones into the estrogens. Now this aromatase enzyme is responsible for converting androgens into estrogens. Androgens are male hormones. To some extent testosterone and all, they are also produced in the female body, and there is an increased conversion of androgen hormones into estrogens by aromatase. Okay. Moreover, obesity being associated with metabolic syndrome results in increasingly higher levels of insulin and insulin-like growth factors. Now, insulin, you know, is associated with diabetes. So if there's obesity, there's going to be diabetes because increasing circulating levels of insulin, hyperinsulinemia, and insulin-like growth factors, which by acting as mitogens, means growth promoters for epithelial breast cells. Now, epithelial breast cells are the cells which line the breast inside, and this stimulates their neoplastic degeneration. Moreover, adipose cells produce several chemicals known as adipokines, such as leptin, and inflammatory cytokines. Now again, please don't get confused. This simply means that they produce certain chemicals which can influence the aromatase activity and estrogen dependent cell multiplication and proliferation. Okay, so because the adipose tissue is responsible for this, it has a significance in increasing your risk for developing breast cancer. Now, besides the increased adipose mass, also the fat distribution has been correlated with breast cancer risk and outcome. Very important, because increased breast cancer risk and mortality, that is death, have been associated with upper body obesity as defined by the waist to hip ratio. So basically, if the upper body obesity is more, then the chances of developing breast cancer is more, and the death which occurs because of the complications associated will be more. So please understand, obesity has a lot of role to play, more so in the postmenopausal woman, but in premenopausal also it does have a role to some extent. The fifth point, lack of physical activity. Lack of physical activity predisposes to obesity and therefore increases the risk of breast cancer. Now, regular physical activity therefore will reduce your breast cancer risk, especially in women past menopause. Though how much activity you need is unclear. Some studies have found that even just a few hours of exercise may be helpful, though more is likely better. A study examined the presence of breast cancer in active women and less active women and found that women who engaged in regular strenuous physical activity at the age 35 had a 14% decreased risk of breast cancer. There are a lot of studies which have shown benefit of physical activity. I'll be covering this aspect in more detail when I'll be talking on measures to decrease your breast cancer risk. Okay, so today I have covered the role of breastfeeding, menopause, nulliparity, obesity, physical activity. Still a lot of factors are there that increase the risk of breast cancer, and I will be discussing them in my subsequent talks.